I'm Jenny Bailey, I'm the current chair for OT PAG, and luckily I've got a bit of a gang. So with me talking today is Glenn Painter, Emily Garrod and Samantha Jeffries. And this really is an absolute whirlwind, quick super snapshot of some of the OT innovation and creativity that's been happening across the Trust. So we really tried to combine a sense of the three divisions and have a sense of the different directorates and services. And just to cover lots of examples like digital technology and some of the unique roles, but also very aware that some of this is absolute collaboration with our therapy colleagues as well, some of our examples. So I'll let Emily get started.
Okay. So I'm going to talk primarily about praise, but I'm also going to mention a little bit about occupational therapy in research. So the praise project very much is a collaborative project with our physiotherapists and our rehab support workers. And it's been led in mental health services for older people. So the idea was looking at promoting independence and stability with adults with early dementia. And my understanding is that it's looking at promoting physical activity, exercise, ADL, and memory strategies and positive risk taking to help aid stability for people with early onset, not early onset, in the early stages of their dementia journey. The OTs have been very involved with praise. They've helped with designing the interventions and have delivered the intervention from the feasibility stage to randomised control trial, and now it's in the implementation project with the Trust, physiotherapists and rehab support workers. And it's aimed to improve the lives of older adults with early dementia and has created multiple research opportunities in the terms of study design, delivery, academic careers for Trust AHPs. I just want to really quickly mention, the slides will be available, but this is all the info about praise. I know our physio colleagues are going to talk about it as well. I just want to really briefly mention as well our OTs who are getting involved in research, including Catherine Stiles, who works in the National Institute for Health Research and is getting quite heavily involved in a lot of the research studies there. I also want to briefly mention Sarah Blair, who's doing a service evaluation of the OT role in memory services, in particular looking at a standardised assessment that we use in occupational therapy for people with dementia or making diagnosis of a dementia.
Lovely. And then I was just going to move on to just give some examples of some of the diverse roles that sense of OTs and kind of new ways of working, some of those sort of more specific clinical focus roles, and maybe some of those sort of non-healthcare based settings. So one example I want to talk about was the community therapy discharge to assess team, which absolutely is a collaborative therapy offer, but just really to talk about the community therapist as coordinator role, the fact that how that sits in within NUH and that integrated hub discussion patients medically fit to determine the right pathway of discharge. And it's absolutely about meeting the needs of the patient. And obviously the teams are very much physiotherapy, OT, assisted practitioners and rehab support workers. But the sense of that coordinator linking with LINSBAR and out of area hospitals to plan discharges into community therapy, and that happening at the earliest opportunity. And the support that the rehab support workers offer, and the fact that the number of those workers has had to increase to deal with the demand for this home first approach. And we really feel it's a great example because community therapy can bridge the gap for care if that capacity allows. It's about getting people back into their own environments and they've been able to reduce short-term packages and some longer-term care packages. And actually they're now focused on outcome measures really to evidence this and demonstrate it. But really just from the OT perspective, it was very much about how the OTs are well placed to look at that ADL progression. So they're utilising that holistic and care-based centred care, using lots of approaches to really focus on that regaining independence and functional tasks, and that helps determine the most appropriate pathway, very much based on that previous and current functional abilities, and really important taking into account the environment and the impact of that. And this is really helping to ensure patients get the right treatment in the right place at the right time. And just to emphasise the point more, is just that I think it's lovely because it's very much part of that national agenda, and we feel like these things become more important as winter pressures. And that sense of adapting services to make that work. So the sense that, you know, all patients are discharged from hospital or bedded unit having that same day face-to-face contact about safe and well assessment, that actually some of the community therapists across the South have adapted to allow flexibility to be able to do these assessments within their current working pattern. And actually they're expanding that to meet the demand for early discharges. And they've already demonstrated actually how that coordination and that integration role has really helped increase the numbers of discharges. And just to move on to another example, so it's quick. And the neurodevelopmental specialist services, I just wanted to talk about an OT specific role, a very clinical specialist role. And this is about autism and ADHD diagnostic assessment. And that's very much using a strength-based approach and very much using standardised OT assessments. And that role is about the occupational therapy assessments and self-care, productivity and leisure, based around the model of MOHO. And it's looking at functional skills assessments. It's having a sense of that sensory informed assessment and impact and interventions around that. It's offering psychoeducation, look at roles and routines, and really being able to build reasonable adjustments to support the individuals. And the outcomes are really focused on having that enhanced occupational performance and enhanced occupational participation in those desired occupations. And it's all about quality of life and well-being, and actually about that self-management and empowerment. But also that role is very much, I sort of talk about as well, because it's about consulting with other teams and being that bit of a specialist point of call to talk about neurodevelopmental needs. And that's just a little bit of a leaflet, but this is obviously slides will be available, but that's a little bit more about the service. And then another example.
Oh yeah, they're going on background. So yeah, I'm going to speak on behalf of Becky Sandy, who is the one and only OT working in fire and rescue services around the UK nationally, which is a really exciting and innovative role. Unfortunately, Becky is unwell today, otherwise she would have talked about it. So I hope I give her justice, but basically it's a great role because in occupational therapy, what we think about is what motivates the person. We think about how they engage with their environment, and we think about their habits and their daily role and routine, which they can all impact and affect someone's risk when it comes to fire safety. So what Becky's doing is she's doing a lot of work on supporting the delivery of safe and well visits, which fire and rescue service do as a routine to older people, but sort of working on how can we explore the risks and the issues a little bit further. I think especially when people have cognitive deficit, that's a really important thing to be looking at. She's offering training to about the OT workforce, and she's developing and marked the Royal College of Occupational Therapy handbook about the fire service. She's collaborating with National Fire Chief Councils and advancing a person-centred frameworks and looking at the person putting in the centre of everything. And it's also a great student placement for students to get involved with. So yeah.
And then the final part was really just looking at a few examples of development and innovations in terms of new projects and new ways of developing services a bit further. So I think Sam's going to talk a little bit about sensory project.
So this is a lead clinical post, which is for a year's contract to enhance the sensory environments of those clients who need their sensory systems to be taken into consideration within the environment which they live. This cuts across kind of quite a lot of sectors within mental health, learning disabilities, intellectual developmental disabilities and forensic sectors. So it works kind of within, but not only with the service users themselves, but with their families, with other staff, to add to their lived experience, with their carers to help shape and transform people's experience of the services for the better, and for service users, carers, families and staff. Considerations and assessments will be given to environments with a framework of looking through sensory lenses at what adaptations, reasonable adjustments and compensations need to be made for an individual to thrive and live their best life. I'm hoping also that as part of the project it will open up ideas to work with different professionals, because I think that there are other specialisms here that I'm hearing about that actually we can draw into the project and really work together with. I know already in my head it's kind of creatively thinking into there are some ADHD diagnoses that really benefit from dietitians to be involved in. So, you know, kind of I think that it's just a kind of starting block, and then it will kind of open up into a wider hopefully enhancements of services to benefit people involved, including staff, patients and their families.
Lovely, sorry, and we're nearly wrapping up, so that's to wrap up. Another little example I want to talk about, and I know this is relevant for everybody really, it's a challenge for all of us, but it's been a real focus of the OT PAG as well, that sense of recruiting the next generation, that sense of future-proofing. And just that sense of, and there'll be examples across the trust, some examples from AMH, but that sense of why it's a need, you know, that's coming from on the ground, from staff, you know, via appreciative inquiries, you know, and this sense that as OTs, when you don't hear about the profession until they're 18 plus, and actually, who remembers being OT at career fair? And often some people start their career journey in a different direction and come to OT a bit later. So we know recruiting OTs is a nationwide challenge. And absolutely, I think locally, you know, for us across the trust, it has definitely been a challenge. And that sense sometimes it post take a long time to recruit. Obviously, that has an impact on OT provision and impact on care. So it's a really important issue. And some of the actions were this commitment across, you know, to join up to NHS ambassadors, so that people can go and talk about the roles into schools. But also there was a 12-week OT leadership placement, so a slightly different style of placement that focused on this as a project and was a bit of a challenge. And through that, produced a kind of fun, creative TikTok style video, really aimed at a very young audience with the theme of a day in the life of an OT. And just that kind of also commitment to providing that clinical work experience for 16 to 18-year-olds, making that kind of accessible to get that message out there so people have the opportunity. And also it's about producing an OT resource pack that can be adapted to a different audience and used to school and used in careers fairs. So there's lots of creative ways, but it's definitely going to be a continued focus for all of us across the trust, I think. And I just want to quick mention to me stuff because there's been a lot of focus on the OT implementation and how we onboard students and having a dual mixed health and social care placement and apprenticeships. So we're really trying to attract connect in different ways. That was a quick example of the pack, and I'm conscious of time, so I was going to do our big finish. So I'm going to hand it to Glenn.
Okay. So if you could get the video ready. So the video was mentioned earlier, the Resonate project at Brampton Hospital. It was a joint venture between OT and music therapy. And I think we were both focusing on different things. So in OT at Brampton Hospital, of course, technology, patients' access to digital technology, quite limited as you can imagine. And as we think about our daily lives nowadays, activities of daily living are almost always done on digital technology. And there's some of it there.
To minimize the
So we ran a group with a little electronic groove box, it's called, although I hate that word, but the groove box. And the patients learned to use it. They created their own music, their own content, and performed a really big gig just before Christmas in the middle of COVID, but we just about squeezed it all in on the day. But the music, I think, is probably the best thing in this video. It's pretty self-explanatory, but the music is by 5 of the service users that were involved in the project.